What is informed consent, and what are the requirements for surgical consent to be considered valid?
Consent is defined as an agreement by the patient to receive medical treatment, having fully considered the information provided by the doctor. Generally, consent can either be verbal, written, or implied. Written consent should always be sought when an intervention carries significant risk and is required by law for certain procedures, such as organ donation and fertility treatment. It involves a doctor undertaking a clinical assessment before presenting the patient with various options for treatment. The patient then weighs the pros and cons of the information provided before arriving to their final decision. For consent to be informed, the consent process should be led by a competent clinician, preferably one who is undertaking the procedure themselves. It can sometimes be delegated to a colleague, provided they are suitably trained and have an adequate understanding of the intervention. More importantly, the indications of the procedure should be clearly explained to the patient, as well as the operative steps, benefits, risks, and potential alternatives. Only when all of this information has been provided, and the patient's questions and concerns have been addressed, can consent be considered informed consent. Finally, for consent to be considered valid, it needs to be voluntary, informed, and provided by a patient with capacity. Valid consent is time and condition specific and may be withdrawn at any time if the patient wishes to do so, or reassessed if the patient's capacity changes.
What is the difference between competence and capacity?
These are two similar concepts that are often used interchangeably. Capacity is a medical judgment which involves assessing a patient's ability to make specific judgments with respect to their care, whereas competence is a legal judgment which describes a person's global ability to perform actions that are needed to put decisions into effect. Both capacity and competence are time and decision specific.
How would you assess a patient's capacity, and what are the key assumptions to bear in mind?
Capacity is assessed in accordance with the Mental Capacity Act of 2005 and determines the patient's ability to 1. Understand the information provided by a clinician. 2. To retain that information. 3. To use that information to weigh up the pros and cons of a particular decision. And 4. To communicate their decision. When assessing capacity, there are 4 assumptions which must always be adhered to, and these are: 1. All patients are presumed to have capacity unless proven otherwise. 2. Capacity is time and decision dependent. 3. A decision made by the patient against medical advice does not always imply a lack of capacity. And 4. A patient's inability to make complex decisions does not imply an inability to make small decisions. If a patient is found to lack capacity, any medical decisions made by the clinician on behalf of the patient should be made in the best interests of the patient. For this condition to be satisfied, the clinician should consider the patient's welfare, social, emotional, and psychological interests also, whilst taking into account any current wishes or advanced decisions. Where possible, the patient's next of kin or power of attorney for health should be involved to facilitate decision-making. Equally, it should be considered whether a decision made on behalf of a patient without capacity can be deferred until the patient regains capacity. Where this may not be possible, the least restrictive option should always be used to limit any unnecessary interference with the patient's rights and freedoms.